talking this afternoon about training frontline workers. And I think, to sort of contextualise this topic within, our discussions this morning and over the last couple of days, I really, as I prepared for this panel, I really reflected on some of the insights that we heard from survivors earlier around, the tragedies of missed opportunities for prevention that they'd experienced in their efforts to, seek a way out. And also the violence of the bureaucracies that they experienced as they sought remedy as well. So I think this is a really, really important, gives us a really important opportunity to reflect on how we can change these systems to be more human and more effective. So in order to explore that a bit more, I want to introduce my incredible panel members. I'll start on my left with Nerida Chazal, a senior lecturer in criminology from Adelaide University and the executive director of Educating for Change. And then further to my left, Natalie Maxwell-Davis, a senior manager for modern slavery at the Australian Red Cross. And on my right, I have Michael Cecilio, program manager for its Healthy to Fight Modern Slavery project and a health policy expert. And finally, Helena Hassani, executive director of Bolin Parawaz, and also a Waratah Fellow with our office. And I should also note, as we kick off this session, that this topic may bring up sensitivities for some people. And also, as I said, it's been a very long 2 days, so if you need to step out and take some air and go look at the beautiful ocean at some point during this session, please do feel free to do so. So I want to, first of all, allow our panellists to introduce themselves a little bit, and also tell us, the elevator pitch of your work around, training frontline workers in how to identify and respond to indicators of modern slavery. And I'll start with you, Helena. Oh, it should be already on.
Thank you. Hi everyone, thank you so much, Lucy, for the introduction. I'm Helena Hassani, and I am the founder and executive director of Bolin Parawaz, which is an organization based in Australia, and we do a lot of work around ending child and forced marriage in Australia. We provide a lot of in-language, in-culture support services to communities and frontline workers, particularly doing a lot of training on child and forced marriage and modern slavery. But I have also been working very closely with Anti-Slavery Australia as a research assistant and deliver their LPP trainings and other trainings to frontline workers. And I think frontline worker trainings are very critical, which we will talk in detail during our conversation.
Fantastic. Thank you, Helena. I'll turn now to you, Natalie.
Thank you, and thanks to everybody for hanging around until the end. We'll try and make it as exciting as possible. I am Natalie Maxwell-Davis. I'm the Senior Manager for Modern Slavery Prevention and Response at Australian Red Cross. I wear a number of different hats. I'm responsible for our own modern slavery compliance in our operations and supply chain. I work with organisations to help improve their response to modern slavery, drawing on our experience in working with people with lived experience of modern slavery, but also people who are in situations that increase their vulnerability to modern slavery. I have a personal ambition of ensuring that the modern slavery legislation does not become a piece of compliance legislation and actually has an impact. I'm also responsible for a project called the Work-Right Hub, and if anybody would want to talk to me about this, please reach out. So the Work-Right Hub was designed in consultation with migrants to help migrants better understand their work rights and know where they can go to access support. And the final thing, and the reason I'm here today, is I worked with, in partnership with SBS and Leon, who's sitting at the table over there, to develop a modern slavery training program that was targeted at organisations, and I think we'll talk a bit more about that in a minute.
We absolutely will. And I'll turn now to Michael.
Thanks, Lucy. So good afternoon, everyone. My name is Michael Cecilio. So as Lucy mentioned, I have a background in health policy. I also have a background in health research and evaluation. So I have another gig at the UNSW's Kirby Institute. Most of my health-related experience has been with New South Wales Health, so either at the Ministry of Health or with the local health districts, both rurally and also within Sydney. So a lot of my my health perspectives do come from a public sector lens. I am currently a consultant with the Office of the Anti-Slavery Commissioner and specifically working on the It's Healthy to Fight Modern Slavery initiative. And that's an initiative that looks to address modern slavery through frontline health. So what we're trying to do with this project is to engage the health system, but also build up capability among frontline healthcare workers to better identify and respond to modern slavery. And I'll be getting more into that initiative as the panel goes on.
Fantastic. And I'll close out with Nerida.
Great, thank you. I'm Nerida Chazal. I'm from Adelaide Uni, but on this panel I'm here in my capacity representing the organisation Educating for Change. We develop online and on-demand training for frontline service workers to train them to identify and respond to modern slavery in the workplace. For the last 3 years we've worked together with Flinders, ACRATH, and we've got Carmel here for representing ACRATH, thank you, and UniSA to develop 6 modules that are discipline specific to train university staff and students to identify and recognise modern slavery as well. And it's now used in 30 universities around Australia, so we're super proud of that, and 7 universities in New South Wales.
Fantastic. And I should also note that both the Red Cross and SBS's training offering and yours, Educating for Changes, were recipients of the Commissioner's commendations yesterday evening. So we'll get on now to a discussion of, why frontline training matters. And I think we've touched on that a little bit already. But I want to start with Helena. So from your perspective, what difference does it make in practice when when frontline workers, are trained to recognise and respond appropriately to signs of exploitation? And what difference does it make including lived experience voices in the design?
Sure. Thank you for that question. I guess from my perspective, training frontline workers to recognize and respond appropriately to signs of exploitation is absolutely critical. It can be the difference between someone remaining trapped in a cycle of abuse and someone finally being able to access safety and support. As someone who has got lived experience of child and forced marriage, while I was doing my schooling here in Victoria, I think if any of my teachers had recognized or identified the differences in my performance, in my being myself and my interaction with my friends, if they had identified and asked me 1 or 2 questions around what was happening, how can we help, I think that had really changed the narrative of my life. I do think that frontline workers, whether they're teachers, health professionals, social workers, or community leaders, are often the first point of contact for individuals experiencing exploitation or forced marriage specifically. When they are not trained, signs of this exploitation can be easily missed or misunderstood, and we actually talked about that from the victim survivor perspective this morning. For example, a young person showing signs of withdrawal from in school or anxiety might be seen as simply having behavioral issues, when in fact they could be under threat of forced marriage or exploitation or trafficking. And when workers are trained, they know how to ask the right questions and in a safe and trauma-informed way or approach. They understand cultural sensitivity, that this isn't about judging families or communities, but about protecting the rights and safety of individuals. They also know the referral pathways. It's so important that the frontline worker trainings are very informed, talk about services, how can They ask the right questions. How can they actually be non-judgmental? Because then that's how they build the trust and confidence to disclose what's happening to them, so that survivors don't have to keep retelling their stories or risk being dismissed or misunderstood. But training alone isn't enough. How the training and response systems are designed matters very deeply. That's where including lived experience voices become transformative. When survivors or people with lived experience are meaningfully involved in shaping programs, policies, and training, it shifts everything from theory to reality. And it ensures that the system we create are actually survivor-centered, survivor-informed, and that they reflect what safety and dignity looks like from the perspective of those who have lived it. And lived experience voices bring nuance and authenticity. They help identify barriers and help professionals to understand the issue very deeply, not just questions, actually understand the cultural dynamic, the family dynamic, how decisions are being made in families, who are decision makers, and how much that young person is being involved in decisions that are going to shape their lives. Ultimately, I think when frontline workers are both trained and guided by lived experience, we move from reactive system to proactive, compassionate and effective responses. We start preventing exploitation rather than just responding to the issue. And we create communities that are more aware, inclusive, and protective of those who are being at risk.
No, I think that's incredibly, incredibly important and really highlights the value of having that really practical understanding of the role that lived experience plays in, you know, not just there being lived experience voices in a program, but being involved in that whole co-design process. And on that note, I wanted to turn to you, Natalie. The Red Cross recently developed a modern slavery training package in collaboration, as you said, with SBS and also with lived experience voices. So can you tell us a little bit about that and how that all came about?
Absolutely, I'd love to, thank you. As Helena said, you know, we know at Red Cross that sometimes people only get one chance to get access to help. And we also know that sometimes that chance requires them to identify that they're experiencing modern slavery, and that is language that they are not familiar with. The other thing, and we've heard it over the last 2 days, is in the community there's a lack of awareness of modern slavery, that people don't know what it looks like and they don't know how to respond. And I've spoken to a lot of organisations where people say, yeah, I saw this, but you know, I didn't do anything about it because I was worried I'd make it much worse. So what we wanted to do is we wanted to increase awareness of modern slavery at scale. And we saw, you know, Modern Slavery Act, requirements of reporting entities as an opportunity to do that. And we also saw the opportunity to engage with SBS and leverage their expertise in production, in storytelling and inclusivity to develop something that was really meaningful. What we wanted to do with the training program was to move from modern slavery as a concept to modern slavery as reality. I think, as you said, Helena, from theory to reality, what does it look like in community? We wanted to address this issue around language, you know, deceptive recruitment, servitude. Who can tell the difference? But what does it look like in practice is something that we wanted to make meaningful for people. We also wanted people to be able to identify signs of modern slavery at a practical level. And I say that really lightly because I think we're being unrealistic if we expect people to say, oh, there's a situation of modern slavery. I think people can see a situation that is not quite right and they need to have the confidence to identify that's not quite right. That's not something that I think will accept. And then we have the response processes and support systems to allow them to respond and help that person get help. The final thing that we wanted to do with the SPS program, and related to that, is we wanted to empower people to act. So we wanted to say, if they saw a situation where they thought this is not quite right, we wanted to empower them so they had the confidence and the processes to actually do something about it, but something that didn't threaten the safety of the individual involved or at risk, and also something that recognised the agency of the person involved or at risk. The person who's in a situation of exploitation, they know what's best for them. They know when they can come forward. They know when they can seek help. But we wanted to put that support system around them. So that's why we partnered with SBS to do that. And we also saw an opportunity to distribute through organisations, through corporate organisations, using the SBS diversity platform, because they provide training for, I think it's over 1 million people now, isn't it, Leon? So there's an opportunity for us to get that message out at scale.
Fantastic. And I think that, core of, frontline workers being able to identify that something's not quite right at a practical level and be empowered to take action is really, really important. And I think turning to Michael now, you're coordinating the It's Healthy to Fight Modern Slavery program. The number of survivors who come into contact with the healthcare system is really, really significant. Can you tell us a little bit about why we need this sort of training in the healthcare sector?
Yeah, absolutely. So I guess we're all here because we believe frontline workers and frontline health workers have a crucial role to play in identifying and responding to modern slavery. And that's backed up by the international research, which suggests that the majority of people who are in a form of modern slavery do access healthcare and see frontline healthcare workers at some point during their exploitation. And some research at the moment also shows that at present, healthcare workers in New South Wales lack the tools and the referral processes needed to identify and respond to modern slavery. So a lot of what It's Healthy to Fight Modern Slavery is about addressing those gaps and about building up the capability for frontline healthcare workers to identify, respond, refer, educate, empower, and also follow up with patients who have been identified as being in modern slavery or who could be at risk of being in modern slavery. It's, I think it really sort of backs up, Natalie, what you were saying around having a practical tool. The It's Healthy to Fight Modern Slavery initiative is also a set of practical tools for clinicians to go away and to have that sort of capability of the competencies around what you need in order to identify someone who is in modern slavery. So for example, we are proposing a set of indicators and signs around modern slavery, based very much around the ILO indicators. There's also a quick screen and an assessment tool so that if clinicians have identified someone who is at risk of modern slavery, that they can actually go through the process of assessing someone's risk to then provide those referral services. And those referral services may be wraparound services, that may be case management, or it may be referring to anti-slavery service organisations as well. There is a learning opportunity here through the initiative. So really, the initiative it's going to, in very practical terms, be a toolkit that contains all of these sets of tools. There is that learning opportunity to put all of those into practice as this toolkit gets rolled out in 2026, hopefully. But also, it will provide the foundations for learning in this area. So, for example, it will provide case studies across a range of different modern slavery experiences, examples, clinical settings, and touch points. It will also articulate what the scope of the healthcare response is, as well as articulating what the patient journey is from presentation through to referral. And we'll also be providing a capability framework as well that will outline the foundational knowledge, skills, and attitudes that are required for clinicians and other healthcare workers to identify and respond to modern slavery.
Great. And I think, the healthcare setting, as you've said, Michael, is really core setting that, many survivors interact with. Another setting that I think is equally important is sort of the educational and university setting, both because, as we've seen over the last 2 days, students, particularly international students, can be very vulnerable, and also you have a whole range of future professionals who are going to go into these frontline settings and develop these skills. Nerida, can you tell us a little bit about what educators should know about identifying these risk factors and how they can train future professionals?
Yeah, absolutely. Thank you, Lucy. And I'll touch on both of those points. So, firstly, the risks that students face and the roles and responsibilities of universities. And then secondly, the opportunities for training students who are future frontline service workers and future change makers. So, as you mentioned, we know students, both domestic and international, face huge risks and vulnerabilities. They are often earning low wages. International students have a lot of pressures on them in terms of paying large fees, a lack of English sometimes, a lot of fear for coming forward. Domestic students as well, a lot of them are living below the poverty line. The Migrant Justice Institute does some fantastic work in looking at the vulnerabilities of students, so that's one place to go to for more information about that. And in our work with Educating for Change, we worked with lived experience advisors who had experience in the university setting, and they highlighted that universities are often their first point of contact, especially for international students who may not have any other supports in Australia. The university staff are their point of contact and the people that they will go to for any issues. And so it's absolutely key that university staff in all areas of universities are trained to recognise what modern slavery, exploitation might look like. And that includes, and the risks are across the student journey as well. So it's from recruitment practices, which we've seen some terrible instances of deception in recruitment. Through to if they were working in Australia. So we need to train then people from professional staff to counsellors to international student support officers and importantly academics. Often students will go to academics, for example, asking for extensions. As an academic, that's the bulk of my work at the moment, is approving extensions. But in that, we can engage with students about things that are going on in their lives. And so if academics are aware of the risk factors and the signs, then they can be really key. So that's really important. Universities really do have a responsibility to look at their training. But the other role of Educating for Change is to look at students as the future frontline professionals. Now we know we want to train our frontline service workers. University students are really a captive audience in the sense, and they can amplify the impact of training as they go out into the workforce. And they're much more receptive often to training and more in-depth trainings. So what we do with Educating for Change is develop discipline-specific training in those key areas. So that is social work, education, as in primary and secondary, university settings, law and justice and healthcare. So our modules are targeted to what it might look like for students when they go out into those workplaces. And hopefully then we're equipping the future frontline service workers to be able to identify modern slavery when they go out there.
Yeah, great. So the next sort of theme I wanted to have us discuss is around what the content of really ethical, meaningful frontline worker training can look like. And Helena, you've talked already a little bit to, how lived experience voices can be brought into training and why that's so important. But I wondered if you could talk a little bit more about how we can bring in survivors' voices in a way that's really sort of ethical and meaningful and also safe.
Thank you so much. I think including people with lived experience or lived experience voices in designing and delivering training is not just valuable, it's actually essential. For us, in order to have the trainings designed from the perspective of people with lived experience is also absolutely critical, but it has to be done in a way that is ethical, safe, and truly meaningful. when lived experience is included, well, it transforms training from something theoretical into something deeply human and impactful. Through my work or our work at Buland Parwaz, we have seen how powerful it can be when women with lived experience of child and forced marriage, displacement, or exploitation are supported to share their insights, not as a case study, but as an expert in their own stories, in their own experiences, in their own rights. They bring depth, cultural understanding, and authenticity that professionals simply can't replicate. However, to make that inclusion ethical and safe, there are several key points that we have to remember, and the key principles are firstly informed consent and choice. We have to ensure that before everything else, people should always have the control over what they share, when they share, how they share, and how much they want to share. We never ask anyone to share trauma for impact. Instead, at Buland Parwaz, we center their voices as knowledge, recognizing that lived experience is expertise. Secondly, I think it's so important to consider safety and well-being because everything is being built into the entire process. That means emotional and psychological supports should be there available for people with lived experience before, during, and after participation in any kind of activities. And it means having clear boundaries, trauma-informed facilitators, and the option to step back at any time that they wish to, or withdraw whenever they actually feel like it. We also make sure contributors are paid fairly because I personally haven't seen that for a very long time. I've been doing a lot of advocacy in the sector, and there was a lot of asking for contribution, but there was no giving back to survivors when they were asked for inclusion. But it's really valuable. They bring their stories, they bring their expertise, and that needs to be very valued. And thirdly, I think it's so important that inclusion must be meaningful, not tokenistic. And again, talking about people with lived experience, we have been, unfortunately, in the sector very tokenistic at times, and lived experience shouldn't be an add-on at the end of the program. It should shape the design from the very beginning and helping to decide what messages we need to be shared and what language feels safe and what professionals need to understand. And I think then we talk about co-delivering. Once we co-design the resources or trainings, it has to be done co-delivered with people with lived experience. And I always say, no decision without us should be for us. If you want to truly consider inclusiveness, make sure that we include them in every table that decisions are being made. The training that is for frontline workers, we need to do consultations, we need to co-design and co-deliver with people with lived experience, because we know what it feels like when you actually go through it. Thank you.
Absolutely, and I think, the other kind of piece of the puzzle, which we'll get to in a little bit, is also around, measuring impact and having those feedback mechanisms from survivors even after the delivery. And Natalie, I want to turn to you now a little bit, because, another aspect of good training is having material which is both, consistent and identifies indicators of modern slavery consistently, but is also tailored to the particular audience of frontline workers. I'm sure we've all done, training modules, whether or not on modern slavery, where you just sort of click through the little slides and nothing goes in. So how did you at the Red Cross, approach developing that consistent core content, but making it specific to, you know, sectors and regions?
Thank you for that question. The SPS program is designed for everybody working in organisations, so it had a general application, and I want to talk about how we made sure that content was consistent, but then I'll talk about how we use it to tailor it to individual sectors, regions, and also roles is another thing too, because people need different requirements in terms of roles. So the first thing about the SPS training program is we started with lived experience. We did 6 interviews with survivors directly for this program, but we also drew on our experience in working with survivors and a lot of other consultation. Survivors were the first group that we spoke to, and they were involved in the manner that you talked about. There was really informed consent. We spent a lot of time on consent. People could withdraw at any time. They were adequately paid. They had the option to pull out. They have complete review of all of the materials before any of it was published. They were included all parts of that process, and that was actually really, really important to us. And it caused some, you know, back and forth because we were quite, I'm sure SPS would attest that we were incredibly pedantic about that. We also wanted survivors involved around what organisations could do. So again, there was a bit of back and forth here because we wanted to engage people, but we wanted to ensure survivors had that opportunity to talk about what people in organisations could see, what organisations could do, and how it could be effectively support their response. The other thing that we did with the SPS training program is we interviewed a wide range of people. So we did 16 interviews, I think, on camera, and it was, you know, a lot of different people. So we did interview people from the Anti-slavery Commissioner's office, thank you, James, and the Commonwealth Anti-slavery Commissioner's office. We interviewed academics, but we interviewed people who work at the front line. So we interviewed nurses, we interviewed our own caseworkers, and we drew on their experience around how to respond because we wanted it to be leading practice, but informed by what actually happens on the ground. We also drew on a range of guidance material, but not just the international guidance material around indicators, because it's not a word that, you know, people are in situations of exploitation or people in the front line would actually even think about, but signs and what it would actually look like, and how they could respond at a really practical level in practice. So let me give you an example. We spoke to one person who said, look, somebody did recognise there was a problem and they gave me this form on modern slavery that said modern slavery, and I couldn't take that out because the person out with me was the exploiter and this was going to get me in trouble. I couldn't use it. So give me a phone number on a post-it note that looks like a bank account detail and let me take that up and hold it, and I can use it when I'm ready to use it. So what do we do? How do we make that relevant to sectors, roles, geographic areas? What we've been doing is we actually try and work with the specific people in those areas. So last week I was working with some members of the property industry, and we worked with them to get them to help us identify what their risks were and what their roles, and started to meet them where they were at and the situations that they would see, and use our material that we'd developed to see how it could apply in that context. We do the same thing in different sectors. So for instance, with international students, you know, with the WorkRight Hub, we've met with, also through the Australian University Procurement Network, a lot of international students around what's the reality of what they see on a day-to-day life. How do they access material? You know, where would they be likely to see it? Who would they go to if they have a problem? And we've tried to integrate that into the response. The final thing I'll say in this, it's not finished. Like, what we're doing with SBS is the beginning, and we're really committed to making this have an impact. So if there's ideas that you've got around things that you'd like to see, let us know, because I'd like to see something that's specific for different sectors and different roles. You know, the issues that people are considering in procurement are different to the issues that people are considering in a hospital setting or something like that. And it's important that we target the materials to all of those people so it's meaningful.
Absolutely. And I think just pulling on that thread of, you know, responding or empowering people to respond at a really practical level, Michael, how do you integrate trauma-informed care into training for the health sector? And is there a role for lived experience expertise?
Yeah, absolutely. I think we've talked a lot about trauma-informed care over the last 2 days. It probably makes sense to talk about why we do it. What are the benefits of having trauma-informed care principles in our service delivery, in our training programs? And adopting that sort of trauma-informed care approach does, according to studies, research, the data, it reduces the risk of re-traumatization, it improves quality of life indicators, it improves health and well-being and safety indicators as well, and then it also improves workforce experiences and outcomes for clinicians themselves. So there are so many benefits to integrating trauma-informed care into service delivery and into training. I would actually say that a lot of the health sector training already does integrate trauma-informed care. I would also say there is a lot of training on trauma-informed care, but there's obviously a chasm between that training and how that actually translates into practice and how that translates into a patient experience as well, because there are so many examples, and we've heard so many of them in the last 2 days, of how there have been so many instances where people have gone through re-traumatization and had impacts on their mental and physical well-being through the care that they've been experiencing in healthcare. So I think even New South Wales Health acknowledges that there is this chasm. There are good examples of trauma-informed care in practice, and there are also so many examples where there is an opportunity for improvement. And I want to cite the integrated trauma-informed care framework that the New South Wales Health PARVAN unit, so the Prevention and Response to Violence, Abuse and Network, so that particular unit released that framework in 2023, which acknowledges the role of trauma, but also the need for trauma-informed approaches in healthcare. I think a lot of these sorts of government frameworks can be very motherhoody and very high level. Something that I feel really positive about with this particular framework is that it is actionable. It feels like there is a bit more of a practical focus around how we might integrate trauma-informed care into service delivery, even broader than just training. So, for example, it lists a few domains across where trauma-informed care is a priority. So that is across health governance and leadership, across service provision, across engagement and involvement of people with lived experience of trauma, across how we articulate policies, even in terms of resourcing. And then, of course, it articulates across training and workforce development. So I feel like there is a push for integrating trauma-informed care. It's really just about now, I think, doing it and committing to trauma-informed care practices. I think in a very practical sense as well. Something that the It's Healthy to Fight Modern Slavery Initiative is trying to do is to pump out that capability framework that I mentioned earlier. And something that we feel is really critical in this framework is to have a capability around trauma-informed care. So it's hopefully quite strong on that. I'd like to think that the whole toolkit is strong on trauma-informed care principles, but particularly around the training aspect. So hopefully this capability framework will be able to inform training programs in the future for healthcare professionals that is strong on trauma-informed care principles from a knowledge, skills, and attitudinal basis.
Yeah, and really, building on the foundation that already exists, I guess, to an extent, even if there are really important gaps within New South Wales Health around trauma-informed care. And I think, on a similar note, Nerida, I wanted to ask, how can we embed modern slavery awareness into vocational and teacher training and related welfare programs and make it relevant to what's already in place?
Yeah, absolutely. It's a really important question, and I think we've touched on some of the main points already, which is that it needs to be specific to the profession and the discipline for it to be relevant. We want to go beyond just generic, what is modern slavery, but now, as Natalie was saying, how might it manifest in this particular workplace, and how does it align with the practices of this particular profession? So that's how we designed our courses, as being informed by the discipline and professional specific needs. And it's actually been the key to embedding it within universities. So examples include our social work program, our social work course. We've chatted with social workers to understand their needs, their language, their concerns, and how it manifests for them in their workplace, and align with the key standards and frameworks and curriculum standards is absolutely key, and especially their discipline placements, for example. So I think understanding the needs of the profession is the key to making it relevant and therefore making it meaningful and being taken up. Another example is our education module, which is geared towards high schools primarily. We've had so much interest from actual teachers in this module. It wasn't specifically designed at the first instance for teachers already out in the workplace. We now have adapted it for that. But teachers were so interested in it, but education departments in universities were actually the hardest ones for us to crack to see the relevance. And so as a team, as we spoke to more educational professionals, we realised we had to reframe it to align with child protection, child safety frameworks, because this is what is important and meaningful for universities in teaching their students when they go out into the workplace. So I think for us, what we have found echoes what the other participants have found. We need to involve the professionals as well and make sure that we are really aligning with what is already out there. What training programs are already out there? How do we build on that? And how do we develop skills, not just the knowledge, but the skills to be able to apply this knowledge in practice in the workforce?
Definitely. And I think, to build that into, the training that the generation coming up, the new workforce, is getting is incredibly important in the sort of next topic that I want to move us on to, which is looking at policy levers and systemic change. We've talked a lot about how modern slavery is a system issue. It's not something that, business or government or civil society can tackle alone, but it really needs that sort of joined up, holistic, mission to change at all levels. And Natalie, I do want to start with you around, which policy levers do you think can mandate or incentivise frontline training, whether that's, standards, commissioning, accreditation, procurement, grants, that sort of thing?
Thank you. And I think when we're talking about frontline training in this context, going on Michael's point, is we're not just talking about training, we're talking about building skills, processes and systems to support people, mitigate, identify and respond. But to go back to your question, and this is going to sound like I'm just stating the obvious here, make it hard to do the wrong thing. Sounds obvious, but we heard the Anti-Slavery Commissioner say this morning, when you've got lax systems, it enables exploitation. So we need to make it hard, and then we need to make it easy to do the right thing and provide support and incentives around that. And I think that's really important. If we want to enable a sort of shared understanding, responsibility and response, we need a carrot and stick approach. So I'm going to throw out some ideas. Accreditation. We run the Support for Trafficking and People program. We rely on a lot of different service providers, and some of them don't have, and service providers at all ends of that process. Some of them have very limited knowledge of modern slavery. They might have knowledge of trauma-informed practice, but they don't have knowledge of modern slavery. So we think, a list of accredited suppliers and incentives around that could be really helpful. The next thing I'd say is grants. I am a lived experience advisor in a different sector. And in that sector, you want money, you've got to engage with someone who's got lived experience. It does become tokenistic often, and it's a bit of a tick box exercise, but we can work on that. Making it a requirement to get grants. As you said earlier, Helena, nothing for us without us. Let us have a say in this. Then let's talk about procurement. I think about this a lot. And, I think that we're pushing more and more down. Well, let me stand back. From our engagement with people with lived experience in this sector, we've found that they've told us that, modern slavery often happens in those small organisations. We've talked about it over the last 2 days, that are beyond scrutiny, when people are not looking at it. So what I see is we're often requiring more and more of those small organisations to do more, to complete surveys, to show they have policies, but that I'm not seeing it have any impact on the people that are actually at risk. So I think we need to flip how we think about it, and how can we enable those suppliers to have a better understanding of modern slavery? How can we bring them up so that they feel like if they see something wrong that they can report it? And I think James might have touched on this earlier, you know, if you get a sector or an industry and part of that sector is relying on exploitative labour, it's really hard to compete unless you rely on exploitative labour. You know, there'd be good suppliers who don't want to do that, and if you give them an option to flip it and to do the right thing, then, you know, we can improve behaviour. And in fact, I was talking to somebody yesterday, I'm not sure if they're in the room, but she said, and she works for a big organisation, and she said, we had a small supplier who said, we want to change this, we want to see how this has changed. So, you know, and they started driving processes through procurement that then fed up the line and got the suppliers around them in the sector to do the right thing. So I think, you know, when we talk about training, and we've all done some really interesting things in training programs, rather than asking more of our suppliers to complete questionnaires, how can we feed them and support them with information around what modern slavery looks like, what the signs are, what they can do if they can see it, how they can support workers in their industry to make sure they have access to fair work?
Absolutely. I think that's a really, really important point of, you know, when we take perhaps a more compliance approach to these sorts of obligations, it can create these burdens for small organisations that they may not understand and may not understand the purpose behind. But, you know, nobody wants to create these circumstances of exploitation. And Michael, I think on a similar note, you know, talking about small organisations that are very overburdened, what are the barriers to implementing mandatory training in a healthcare setting?
Yeah, absolutely. You know, burdens as well in big organisations. You know, like in the last 2 days, we've talked a lot about system failure and the role of bureaucracy, or the barriers that are caused through bureaucracy. And sure, like in large entities, there is always going to be some layer of bureaucracy that's helpful for defining roles and defining accountabilities and priorities across a system. But I think we've heard so much as well around how bureaucracy, you know, also leads to barriers. And I think that system-wide mandatory training also falls into that scope, you know, particularly when we're thinking about public sector, when we're thinking about New South Wales Health. So, you know, I think, you know, like, don't quote me on this figure, but I think last I heard there were about 130,000 employees within New South Wales Health. When we're thinking about mandatory training for, you know, across the system, you know, there are priorities that I know that system executives are trying to think about in terms of managing the burden for healthcare workers. So, you know, particularly those who are dealing with high throughput, you know, such as frontline clinicians, and they do have a lot of mandatory training. So which are the mandatory trainings that need to be prioritised for them? And then, you know, they're also thinking about, you know, the costs to the health services as well, because you add in a program or an initiative or a training, there'll be an opportunity cost at another end. So you add something in, you take away from another. So, you know, there are going to be the costs of developing and designing and rolling out and evaluating the training and seeing whether it's effective. And then it also takes workers' time away from, you know, from the front line. So the cost to the service, but also the cost to the patient. So these are all the things that the health system are thinking about. But also, like, you know, that's it's kind of not good enough. You know, like we've been hearing as well, like earlier today, or was it? I think it was yesterday when the Commissioner was mentioning about the fragility of modern slavery resourcing, and maybe we need to put more into this. Like, I don't know if thinking about costs, you know, from this perspective, like, oh, there are no resources, is a good enough excuse, you know, so much. So I think there are definitely some bureaucratic issues at play. I think from a training, design and delivery perspective, there are also some barriers there. So, you know, like we were talking about, you know, the centralized online platforms that mandatory training kind of live on at the moment. So it can lead to a bit of a click, tick and flick sort of exercise where, you know, like there's, you know, people complete the training, but is there actual knowledge retention? is there relevance and meaning for the person who did that particular training? Understanding these platforms offer that cost-effective and efficient way to roll out system-wide training at scale, but is it actually optimal? I'm not quite sure, having done a lot of those trainings myself. So I think there are some systemic and some training delivery barriers over there, but I think in terms of the way that we overcome them, I think it's an even broader conversation than just training. I think also what we've been talking about over the last few days is around how do we engage the systems? How do we engage stakeholders and senior executives around how to address modern slavery? So yes, training is a part of it, but I think it's also it's a conversation about how do we get the health system to identify that they have a role to play in addressing modern slavery. So I think there's a lot around advocacy that needs to be done. I think particularly for the health system, it's around communicating how there are costs to the health system when you don't address something like modern slavery. And I think, the role of lived experience experts is going to be key to that, because I think, especially over the last 2 days, the power of the stories of people with lived experience is so powerful. Like, I find it really hard to not be moved, and I would find it really hard for the system, like for system executives, to not be moved by stories as well. So how do we? I think there's something to leverage there. I think also when we think about the health system, they love a good data story, they love research. So I think if we shore up our data collection and our research, I think that will help with advocacy around that as well. And then how do we support healthcare workers to understand the scope of their role in the modern slavery response too? So I think there are a few things there to advocate to the system for, which includes training, but is also beyond training too.
Yeah, absolutely. And bringing it, I guess, finally back down from that, organisational system level to, how the system approaches the individual who needs to use it. Helena, what's something that you wish someone had done differently in your case that training maybe could have changed?
I think something that I had wished for was identifying the changes and seeing the signs in me and the changes that has happened, and then asking the right questions. Because often we put these topics in the too hot basket. We actually don't take the time to think and come up with the right questions. We either make assumptions or we actually ignore it completely. And I think when we ask culturally sensitive questions, we are not being judgmental. We're actually coming from a curiosity perspective. We want to know what's happening. We want to know what can we do to help that person who is going through the issue, forced marriage, for example. And I think now that I reflect and think back at those times when I was in my high school here, I had all of the identifying signs of child and forced marriage. I was seeing counselor. I was actually seeing school counselor. I then went to my uni. I then saw my uni counselor. I was seeing regularly because it was impacting on my education. And at times, like you said, Nerida, we seek extension for exams, for assignments, and I did go. I requested support letters. No one identified. No one actually recognized what I was going through. And I don't even recall the questions being asked from me. Okay, what's happening? Why do you need extension? Or why things have changed for you? Because I was a person full of energy. Always there asking questions, curious, wanted to learn and know everything. But it's once you miss that opportunity and you don't ask the right questions, that person's life is completely changed. And also, it's also really important to remember, a lot of survivors are actually reaching out once in their lifetime. And if we don't have frontline workers being trained in the on modern slavery, and you don't ask that question, you have missed that opportunity. That person might be actually dead, because I have seen scenarios or cases in the Afghan community in Melbourne where they have sought support, and because they were not asked the right questions and not provided with the right support, they had gone back and they have their life has been taken away from them. So it's so important to actually be curious, get to know, and validate people's emotions and feelings, and also being empathetic, being very trauma informed, rather than what we see in our system is one person does the assessment, one service, and then you refer to the another service, and you re-traumatize that person by going through the same assessment, doing the same risk assessments, not knowing that the systems have changed now, which is really good. We have information sharing system that you actually don't have to re-traumatize individuals with lived experience. But that is a gap in our system where, one organization or one service is not holding the entire information. And sometimes it's too late to get the entire information from someone. So I think one thing that I really wished for the frontline workers to have identified and asked a very simple question, and that could have changed the whole story.
I think that's so important, is just, and something we've heard so much over the last couple of days is just the importance of people being humans to each other, and, asking the questions of you as a human of, why are you, asking for extensions, and why have, you changed personally. I think that's such an important, such an important point for us all to keep in mind, as we all are parts of various systems. So I might give everyone about 30 seconds to just talk to measuring impact, and then we might wrap it up with a...
I'm happy to start. I think from the lived experience perspective, creating a safe creating safe survivor feedback mechanism is absolutely critical, because that needs to be involved in terms of trauma informed consent, and giving the choice to victim survivors to actually talk about how the programs or trainings are being impactful for themselves based on their lived experiences.
Great. Thanks, Helena. I'll try and keep this quick. I love evaluation, so I'll have to be quick. I think that evaluation is really key to holding the system to account. So I think while it will also show, I think evaluation will be a good advocacy tool to the health system around the need for change. I think it also helps hold the system to account. So I think when we think about evaluation, I think we think in terms of the effectiveness of whether training translates into better care outcomes, but I think it's also about the fidelity of whether training has actually been offered and in the way that it's meant to be offered too. So I think we need clear metrics about what we're evaluating when it comes to training, which will also include how we measure trauma-informed care core principles and ensuring that we use validated measures. But I think also having a 360 feedback loop around how we collect data from a lot of different sources and from key stakeholders across, and maybe quite much broader than we'd think of, and making sure that we do that in a mixed method sort of way. So quant and qual, I think, is really important for getting a comprehensive assessment of translation.
Absolutely, and we need people with your passion for monitoring and evaluation, Michael.
Fantastic, big questions, thank you. I think the impact and quality are linked, and they're linked to, a key is partnerships. It is involving a whole range of people and getting them to be part of the development and the assessment and the evaluation. So we test our modules with students, we involve the professionals, we get that continual feedback, and I really love Natalie's point about this is not the end, it's the start. So it's about that that continuous feedback. On our project, we've collected a whole range of data as well, and we've got pre and post course surveys to look at knowledge acquisition. So it depends what you're actually measuring impact of, but if one of them is knowledge acquisition, which is one of the easier things to measure, then that's one piece of research that we're looking at evaluating our courses in the future.
I have 0 minutes, so I'm going to be really quick. Start with lived experience. Understand what behaviours you want to change and encourage, and make sure that you involve lived experience in that, so that you can encourage those behaviours. Recognise you might not get it right to start with, so be prepared for progressive improvement and involve people with lived experience in that, so that you can have an ongoing feedback loop and continue to improve.
Excellent. Well, thank you all for a wonderful panel.